Welcome to Big Butts No Lies. I'm Mavi, your go to guide for everything plastic surgery. With 18 years in the industry working alongside top board certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? As promised, I'm bringing you surgeons from across the country to help you in your transformation. And today I'm super excited to have Dr. Anil Shah out of New York. And we are going to deep dive into some really interesting topics about facial balancing. Thank you for being on the show, Dr. Shah.
Thank you, Mavi. Love being on your show. I'm so excited to talk about like anything you want to talk about, especially with the face. Hopefully, we'll keep it neck up, okay?
Neck up. I love it. You know what? That actually brings up a really good point. Why are we keeping it neck up? What makes you the specialized surgeon for when somebody is looking for facial treatments?
So my background is I am a facial plastic surgeon. I practice exclusively in the face. And there's different surgeons who work on the face, as you know, and we can see in your podcast, which is amazing. So plastic surgeons will work everywhere. They'll work on the body, breast, face, all of that together. Facial plastic surgeons work exclusively on the face. So you would not want me to, nor would I do that, do liposuction or breast augmentation, all that. And then there's some doctors who work exclusively on the eyes, oculoplastic surgeons, maybe not called oculofacial surgeons, but facial plastic surgeons really, what I focus on is basically necks and noses. Those are like my two things that people, if they're going to come and see me for, almost always it's one of those two things.
I love it. I love it. Okay, so we love a specialized surgeon. And why don't you tell us? I love to rewind and go all the way back to what made you decide to be a plastic surgeon?
So it's particularly the face. So I come from a family where my dad is a physician, his brothers were physicians, and I had an uncle in England who was a head and neck surgeon. By the way, in the UK, they don't call surgeons doctor; they call them Mister. It's kind of the lineage that they come from. It's called surgeon barbers, and so it's more of an honor to be called Mister. So he was a prolific head and neck surgeon, and I was really inspired by him. And then I've always been inspired by the face. If I look at faces, this sounds a little strange, but there's a reason we do a picture of our face and not like the rest of our body, because our faces are a unique identifier. It's how we identify how we look in the mirror, how even our phone identifies who we are. So I've always been fascinated by the face, and putting that all together, like when I had a chance to do a rotation in Florida as a medical student with a facial plastic surgeon, I was like amazed that you could get paid to like transform someone. And I was like, I want to do this every day for the rest of my life. And I would do this if they didn't pay me, but they do.
And that's why they say when you love what you do, it's you don't work a day in your life.
There you go. That's exactly the truth.
I love to hear it. So, with that, you're an expert at looking at faces, right? And when we start looking at our faces as we get older, there something happens, right? It feels like it's melting, it's coming down our cheeks. What when you're approaching a consultation and a woman comes into you and she's like, I don't know what I need. I just know something's going on and I don't look how I did 10 years ago. How do you approach that?
I like to not start with negative. I think in the world, we always start with negativity and say, I'm here. And a lot of patients feel down about this. They're like, I don't look like I'm used to, like the world is coming apart, and they see things that how they used to look, and it's not going to get better. It's only going to get worse. And it's like this doom and gloom. And I actually like to try to turn the conversation around and really just talk about what I like about their face. And usually there's always something, and everyone is their own worst critic. And we'll look at their eyes and their skin and their cheekbones and their smile, and you'll look at their hair, and I pointed out to them. And when I first start off with that conversation, I almost see that they don't believe me. They don't believe that they are beautiful. They feel like they're maybe they feel like they're just not what they are, and they just feel like this downhill trip. So when I talk to them about that, they almost always look at me that way. When we're done with the transformation, the way they look differently and the way they react, that emotional component, that's what it's all about. You'll see them sometimes when we're done, they'll like hold on to the mirror. I have to like pry the mirror from them because they're so happy about doing that. They wear brighter clothes. They wear all of that. And so what I'm trying to do is that consultation, kind of circling back, is really trying to see what's going to make them regain, what they, maybe what looks different from, age maybe 50 to 40 or, 30 to 40.
I love to hear that. You're so right. We do. I say it all the time on the show. We're looking in the mirror and we're just scanning, like, what's wrong? What can I fix? What needs to be better? And we do need to appreciate just kind of where we are, right? Where we are right now, and how, um, what's that saying? You're never going to be as young as you are right now. So enjoy it.
But that being said, there's like the flip side of that too, because when someone comes in, we almost always discount experience. Like, um, you're super experienced at what you do. I have a lot of my patients who are super experienced at what they do. You can't do this overnight. And for example, if I wanted to be, let's say one of my patients is an accountant, I would first of all be the worst accountant in the world. But if I tried to just do this, it would take me years to be like proficient at that. And a lot of times we discount our own experience of how good we are, and our patients do. And we're like, hey, guess what? I can change your outside easily. It's just a choice. Find a really good surgeon, make some good choices, lifestyle choices, but changing the inside, that part of the like our skill set, who we are as a person, that's actually a lot harder to do. And patients they always discount that part. But when you see someone come in who's just a genuinely great person, who's smiling and that part of it, and this is the part that's just kind of missing them from having that extra layer of happiness, that's what it's all about.
Oh my God, I agree with you so strongly, just because I've seen it so many times right in front of me with the clients that I help through their transformations, and thousands of patients that I've seen over the last 18 years now. So I completely, and I see exactly what you're talking about. We talk about that on the show actually quite a bit, about the internal transformation that you have to go through to even appreciate the results that you're seeing, because as you know, there's that very slippery slope of perfection of, oh, if I could just get a little bit more over here, or if it was just a little bit tighter here, everything would be better. So we always talk about just bringing our expectations of perfection kind of down a little bit, and appreciating what we see in the mirror after surgery. And if we don't see, can't appreciate it, then there's a lot more work that has to be done to be able to appreciate it. That mental health aspect, we've talked about it actually quite a bit on the show, because through the show, I've learned so much just from talking to women from across the country, that their results could be a home run, perfect, but they might not see it. And that's when we really started to, I could go so far into the what we've done, and just to bring more attention to the mental health aspect of it just with the show, but that's for another episode. Today we're going to talk about facial balancing.
It's all good, but so facial balancing. Okay, so that's kind of a word that a lot of people are kind of like throwing around and stuff. So do you hear that a lot now, or just
I hear, okay, so what I hear a lot of women come to when they're talking to me, it's mainly, I see changes in my face, but I'm not ready for surgery. So they're looking for minimally invasive things. That's just because of my age group. My age group is usually like 25 to 55. That's the age of the women who listen to me. And so sometimes they feel like a facelift is way down the line, like in my 60s. What can I do right now that's minimally invasive? And it's a conversation that I often have to have of this, well, do you want to wait until you're 60 to start doing the surgical procedures, or do you want to start doing some stuff now? And it always leads into that new term, the undetectable era.
there we go. And so I think it's interesting that conversation of like when someone comes to see you, like I don't know your experience when you're talking to someone, but I think certain things when I talk to someone are slightly personal. Like I don't mention unless they come specifically to see me for that. Like if someone says I want to look younger, I almost always don't talk about their nose because like the nose is personal. Like it's one of those things that someone has like their nose, and if they really like enjoy their nose and it doesn't bother them, I'm like, let's not open up that box because if you transform noses, like very very rarely do you see someone with a perfect nose. It's just the nature of noses. But when someone comes in for transformation, they want to look balanced. I think often you have to have an open, honest conversation, but you still have to avoid certain areas to like not talk about or bring up unless patients bring it up. Do you agree with that?
Oh my God, so much. You bring up such a good point because I've been in the room with surgeons who don't manage their consultations like that. They manage them the opposite, where let's just point everything wrong that's on your face. And the patients walk out devastated. I mean, who wouldn't? I don't want to sit in front of somebody and let them just dissect my face and tell me everything that they could do to make it look better or different or what's wrong. So I 100% agree with you.
And a lot of times, like when I'm having that conversation, it's nice to have kind of like patients see themselves from like a third party perspective, because I think when you look in the mirror, there's a lot of connectedness. Like we're used to looking in the mirror, but then we see ourselves, we're still connected there. And a lot of times patients don't see everything. Like they don't see their profile, they may not see their neck, they may not see other aspects of it. So I love, when I have a chance to kind of like pull up an image, like a 3D image is really a nice way of looking at that. And then you can actually create this symmetry of the face. You can look at what things would look like. You can talk about balance. You can kind of create and simulate some ideas for them. And then from there, the patients can get a better appreciation. So maybe they're like, hey, do I want to improve my chin? Almost always when they look at themselves as a third party person, patients will almost shout it out, like, you know what? I think I need something with my chin. Oh, there's my neck. I want to do that. So things that might be personal to someone else, they're bringing it out. And when they bring it out, it tells you, hey, guess what? I want to improve myself. Sometimes they need guidance still. And I'll just say, hey, I want to look, how I want to look. But a lot of times they'll bring that out when I have them as a third party.
I love it. So when you're looking at a face during a consultation, how do you usually analyze it? Like what are you looking at?
So there's kind of like these rules of plastic surgery. And I say you can look at these rules if you're like starting out and trying to analyze a face, but more than often, I like just throw these out because they're not like rules that have been like they're not like rules like gravity, which have been defined and like analyzed, and everyone knows that's a fact. They've been created by men, most likely men, if it's an old rule. And like who's to say that this rule is perfect? It's a guideline. And so what I like to do is just look at someone, and the first thing I like to do is I want to vibe with someone. So I want to know like what is this person who's coming to see me? What are they about? Is this a 50-year-old woman who is recently divorced, who's on the market? Is this a 26-year-old female who is about to get married? Is this a 20-year-old who needs to have her face get balanced with the rest of everything else, and she has a really petite face, but for whatever reason her nose doesn't match with everything else? So it's really about I want to find the vibe, and I want to find like what is going to make this person happy. And sometimes they'll know, and sometimes I have to kind of like gently again kind of navigate that to kind of really bring that up. So it's such an individual thing. And the other thing is like plastic surgery has like levels. Tell me if you agree. Like, I mean, with your consultations, you probably had some patients who would come in who are like, they want like blah 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 boom, they want this main change and all that stuff. And it's kind of the same thing with the nose. If I see someone coming in with really long lashes and they're wearing like a really bright colored dress, I know that they're probably like I would call like a Lamborghini nose. They want something that's really feminine. They want really like this super feminine, and it can look a little bit. I don't want to ever look fake, but just a little bit more on the feminine side. That I call that. And then I have someone who comes in, let's say, who's wearing like gray tones and very kind of understated the way they talk and what they do, or maybe so they might want something more on that natural side. So you're always kind of like shifting your like what you're doing to design someone's face, so that they have that balance.
That's so cool. I love just to hear the psychology of like what you've gained in experience with working with all of these different people, different walks of lives, and different foundations, and how you're able to see how they're walking in, kind of how they carry themselves, and know, okay, most likely they're going to be leaning towards this direction.
And the interesting thing is, I used to kind of like go back and forth. Like, let's say I'm doing a nose, for example. I used to kind of go back and forth and like, let's what do we want to do? Now I've been doing this for so long that I just make a nose for them, and I say, okay, I'm just going to design a nose I think is the best nose for you. And then when I'm done, it's not like 100% what they want, but it's like 97%. And I'll say, hey, let's now I want you to tweak whatever you want. You can change this to whatever nose you want. And then they'll surprisingly, like when they're changing this little parameters, they may end up with a nose that's different, but it's like very, very, very slightly different. It might be just slightly up a little bit, might be slightly in or out a little bit, might be slightly smaller, wider, but it's not radically different. It's like really close. And that's the cool thing about that vibing part, where it's just sort of like, it's not a hard rule of like, hey, your nose has to be exactly at 90 degrees or 105 degrees. It's about, hey, let's match this face. Let's match the nose to the lip and the chin. Let's balance it with the proportions of the face. Let's balance it with their personality and what's going to make them the best person.
I love it. I love to hear it. I like that you're bringing up noses, because we've talked about rhinoplasties on the show before. We were going to talk about facial balancing, but rhinoplasties just really seems to be something you're really passionate about. And I love talking to my surgeons about the procedures that they're super passionate about, because that's where I feel like you really do shine.
I think if you talk about balancing, though, I think the nose, the reason I'm mentioning like the nose is a lot of times if you're trying to balance the face, the key element is like, does everything match? Do the are the eyes and the cheekbone and the chin? So the nose can be a really important part about balancing the face, and it doesn't have to be a radical change, but a lot of times it's just, and so it's kind of one of my favorite procedures to do, because not only can you balance the nose to the face, but you can actually balance like your breathing, the way you function, and which is has long-term ramifications. So it has health benefits, it has facial symmetry balances, so all of these things together.
Absolutely. So, in this facial balancing rhinoplasty, the next thing I think you're going to mention is the chin.
Uh, yeah, the chin. So I used to be, okay, this is going to be like one of those controversial things. I used to be like, believe it or not, I was the number one chin implant person in the entire Midwest. Almost
Wow.
everyone orders it from Implant Tech. And it was like, I did like so many chin, like I did like one live on Fox News. I was like, I did, but that being said, I altered my balance approach. And what I found out is, a lot of my female patients, I used to have to make the nose come out more, or it's called being projected, because it was hard to kind of really make it small. I altered my rhinoplasty technique where I was able to make the nose smaller, so I don't have to make the chin come out as much. So I definitely do chin implants, but I don't do them as much as you think. But it's one of the funner things to do. I just came back from a conference in Vegas, so we are talking about jawline and jawline enhancement. And when you talk about the chin to kind of really balance it, again, there's so many nuances to balancing this. Like I can dive into all like the technical things, like is your crease here too prominent? Is your chin hanging from here? Do you want more of a V shape or square face? And it's just like the idea of like, should we do an implant? Should we do filler? And there's so many great, like for example, I have filler in my chin, which is, I'd rather do an implant, but I have filler because I can't operate it myself. And, and I didn't do the filler myself. My wife, I work with her, and she's an amazing injector. So, and I also work with Jonathan, who's an amazing injector, and Jess. But that being said, you know, you practice what you preach. You know, like if your patients are going to do it, you have to do it yourself. Except for surgery part, I think I just have really specific things that I do that I'm like, not everyone does, which is kind of
You're like, so you can't find somebody to do it for you.
I can definitely find someone to do it for me, but there's certain things you do, like the way I do a nose, like there's everyone has their own way. This is the interesting thing about one of the reasons I like rhinoplasty. If you went to 100 different rhinoplasty surgeons, you would have 100 different techniques. Like no one does it the exact same way. And the way I do it is like way different. There's parts of it that I do that are similar, but there's parts of it that I do that are like no one does it in the world. And that's like it's just that aspect of it. And I think to me that's super cool. And if you see, for example, let's talk about like in the body, like when someone does liposuction, there's definitely going to be some artistry and different people doing it, but there might be someone who does a vaser, but there's maybe if you go to surgeon X or surgeon Y, there's definitely going to be a difference in how meticulous they are and how they shape, what they're doing. But if you go to surgeon X or Y for rhinoplasty, you're going to get like a completely different approach. It's a little bit like that with facelifts and neck lifts, a little bit, but it's way more with that rhinoplasty.
I actually just read an article earlier today where they were talking about Kris Jenner's facelift, and they
Uh-huh.
were mentioning, oh, that her I don't know what kind of HIPAA violations are going on, supposedly, that the surgeon's office released what kind of procedure it was and that it was a SMAS lift and that it wasn't this other specific type of lift. I don't know how much of it is true because I know that there's probably not HIPAA violations happening with such big cases, but the point of the article was that there's such hype online for deep plane facelifts, and that most of the plastic surgeons across the country are doing some variation of a SMAS lift, and that it's these very nuanced differences in the two procedures that everybody's confused. And I think that's probably similar with what you're talking about.
Kind of. I mean, well, right now, if you go to a meeting, everyone says they do a deep plane, and not everyone does a deep plane. And then the biggest issue with like facelifts, I mean, there's a couple of things if you dive into that, like there's some nuances. Is like everyone asks like, okay, what's the best technique? Who's the best at facelifts? And what happens is, like you'll see some surgeons who are just like cut and paste. They'll say, hey, Surgeon X in LA is really good. I want to do exactly what he does. And there's like people who just try to mimic what Surgeon X does, and they'll try to do the exact same thing. Then you have Surgeon Y does this, and they try to mimic that. But then there's people who actually like change like the field and say, hey, I'm doing this completely different approach and different technique. And those are kind of the fun things. So facelifts are a little bit different, but there's a lot of copying. Deep plane and SMAS lift. Do you know the difference?
I do know the difference. It's been explained to me, but I know our listeners want to know exactly what the difference is.
Okay, so think about this. So SMAS lifts are going to be probably more popular because of Kris Jenner. But deep plane is the one that a lot of surgeons think is kind of creating a more natural result and probably longer lasting result. And everyone gets super hyped about Kris Jenner because they're seeing her, we don't know how far out she is from surgery. But the other question is, how long is this going to last? All the other aspects of it, but she looks amazing. So a SMAS lift is essentially you're lifting the skin, and then there's this layer under the skin called the SMAS. And then a SMAS lift essentially is you can just put a suture through this layer, you can cut out a little bit of the SMAS, you can lift up a little bit of the SMAS, and then basically you're just going to suture this back. The reason this surgery became a little bit out of failure is because there was a lot of skin undermining, and patients can sometimes get these obvious stigmata of having a facelift. And so you would see these little swoop deformities and weird vectors and all of that. Now, this is true of every technique, but the SMAS lift was notorious for having that issue. The other issue with SMAS lifts is the longevity. And that was one of the reasons I switched from a SMAS to a deep plane, because I used to be a SMAS lift surgeon like way back. But my patients would be a little swollen. Again, I was a younger surgeon back then. But then they would look kind of very similar at around a year to a year and a half. And that was kind of disappointing. Um, deep plane facelift is you don't really lift up the skin too much. And depending on the variety you use, I'll talk about the one I do. I go underneath the muscle in the face, and there's an avascular plane. It's a plane that is a gliding plane that we're being formed as embryos. So you go underneath this whole plane over here, but the skin isn't being lifted. You're under a deeper level. It's a deep plane. And then this layer is lifted back. And so that's considered a little bit more of a comprehensive lift. I do that essentially on almost everyone, even my younger patients, which is now in vogue, like getting 37-year-olds and 41 and 42-year-olds are now doing this instead of fillers. So the reason we like that is because you're treating the pathogenesis, like what caused the aging. The muscle is slid down. You're sliding this muscle back to where it's at. You're not stretching the skin. You're not putting tension on the skin. And then it's all about hiding your scars. So I'm a proponent of deep plane. But there's a lot of surgeons who say, hey, guess what? That's a really hard technique to do. I'm going to stick in my comfort zone, which is the SMAS lift, which again, if you're comfortable with that surgery, that's great. Just that if I have patients seeking me, they say, do you do a deep plane? Like, yeah, that's my. So.
I agree. I agree with the deep plane. My what I think we should talk about is okay, so if the SMAS lift has less longevity, the how long usually, I know it's a range for everybody, but what's the typical amount of time that a facelift result lasts?
Okay, so this is the question always everyone wants to ask is like, how long am I going to get out of my facelift and neck lift? Like, this is such a fun question. Okay, so I think how long it lasts really depends. First of all, if you do nothing, so let's say someone does a facelift at 50 and they have a twin, you can actually look at this. I've seen this in sisters as well. If you do a facelift and your sister or twin does not do the facelift, you will always look 10 to 15 years younger. So you're still going to age, but it's sort of brought you back up this aging paradigm. If you do things along the way, like you take care of your skin, you take great skincare products, you laser yourself, maybe you keep up with a little bit of fillers and all that, you're probably going to extend the life of your lift. If you have a really, really good lift and you do nothing, and you have good skin, I mean, 15 years is reasonable. And that tends to be where my patients are about every 15 years or so. Sometimes a little bit more if they really are on their skin. If you have the worst lifestyle ever and you're drinking a lot and you're going in the sun and you're not taking care of your skin, you're not going to see as much change because even though your deeper layer is lifted, your skin's going to have laxity early on and other issues. So the poor facelift is tend to last less than 5 years. A good facelift is around 15 years, but it's all over the place, obviously.
That's a perfect explanation. I want I want you to tell us, with all of your experience and everything you've seen come on the market, new technologies in skincare, new technologies in lasers, new technologies in resurfacing, all of these different things that have come on the market since you've been in practice.
Mm-hmm.
What would you say are your top favorite things that really, really make a difference?
Okay, so I think if you said, let's talk about non-surgical things here, okay? So is that okay?
Yeah.
And so if we're talking about non-surgical things, what would be my favorite things? I'm really into no downtime lasers. Like no downtime lasers are like a game changer. The old lasers, like our parents' lasers, are not the ones you want on your face right now. And there's people with these, even in some of these high-end offices in New York and LA, they have these really old lasers that are going to basically burn your face. I actually had one of my patients who is a Chicago patient, and she went down to another state. I won't even say the state because then it might be, they might know. But she went to another state and just said, "Hey, I'll just do a laser." She's been a patient for years, and they screwed up her face. Oh my god! They used an old laser, and they didn't do any of the new stuff that's out there, like as far as regenerative care. So again, my favorite one is no downtime lasers that can work on all skin types. There's newer CO2 lasers that you can treat my skin and your skin. I'm part Indian and part Italian. What's your background?
I'm Mexican.
Mexican. Yeah, and again, even within Mexican, you're going to have so many different like varieties of skin types and tonalities and all that. And so when you can treat all skin types and have no downtime, fantastic. So that's one is a no downtime laser, a newer CO2 that's like so fast that you can treat your skin type, my skin type, and you can hopefully do something in 1 day or 2 days. Another game changer is Pico technology. So Pico technology is it's out there. It hasn't really embraced the U.S. as much as Asia. So you're familiar with Pico a little bit?
A little bit, yes.
So most people think of Pico technology for like tattoos in the U.S. And then if you've ever been to Asia, you know the mecca of plastic surgery and skincare in the world?
Korea?
South Korea.
South
That's
Korea,
right. Like
yeah.
we love our skin. But they have this to a science. Like they are so into skincare. It's like when I went to South Korea, my daughters are like, I'm buying masks. They ran over to like the stores. They wanted to get all the skincare fun stuff. And they're really into it. And if you're walking around, you'll see all these signs for Pico laser. And the beauty of a Pico laser is it is a trillionth of a second versus a billionth of a second. It doesn't even work with heat. So you can have melasma and it's safe to use. You can have my skin type or your skin type, and you can treat pigment. A lot of patients of color, but even Caucasian patients, you're going to see browns pop up, reds pop up, and what happens with your skin is it can make your skin look dirty. And so the idea is that if you can get your skin basically uniform in coloration, you don't have to wear makeup. You can walk around, and it's amazing, and that's a fun thing. So I'm really into Pico technology, which I think is underutilized in the U.S., but it is a game changer in skin. Another thing that I think is really cool. We have what, 5 you want? I can keep going, but I'll list a few.
Keep going. We want to know.
Okay. Another one that's interesting are exosomes. So you've heard of exosomes?
Yes.
We've been on that front for about, oh my God, like at least 5+ years. And the beauty of exosomes, so first of all, you have to have the right exosomes. Let's define what an exosome is, first of all.
Right.
So an exosome is like a specific way of talking to a cell. And most patients, like when you're trying to throw a growth factor, it just kind of goes everywhere. Exosomes go specifically to the cell you want, and it'll tell it what it wants to do. And if you're thinking about exosomes, they usually come from either like placenta or from fat or from umbilical cord. So there's a bunch of areas where it can come from, and they're trying specifically to change the way the cells work. So I've had some miracles with exosomes. I had a patient who basically had almost a 3rd-degree burn of her face because she fell on near the lakefront. This is in Chicago. And what happened is her skin was down, her epidermis was down, her dermis was down. She was down to her subcutaneous tissue.
Oh.
So she should have scarred. She should have had a permanent scar here. And what I did was a series of exosomes and growth factors. I didn't do any surgery on her. In 3 weeks, she looked like her skin, like nothing had ever happened to her.
Oh, bless her. Thank God.
Oh my gosh, thank God for her, because they would have like ruined her life. And so she is such a sweetheart. And that's the power of regenerative technology. You can channel that into your laser recoveries. You can channel that into growing your hair, which my hair, by the way, is fake. It's not like it's not like yarn.
You're gonna have to tell us more about that.
Yeah. But so when you can control your healing process, and you can make someone who's going to heal with the laser in 4 days, depending on the laser, into 2 days or 1 day. If you can make someone heal from a rhinoplasty so that 1 week they're like already reasonably happy, or a face and neck lift where they're grocery shopping at 1 week and event ready in a month, you're controlling that whole part of it. And I'll dive into that again with the next one, which is hyperbaric oxygen. Have you used that or dived into that with any of your patients?
We have been talking about hyperbaric for after their mommy makeovers, tummy tucks, those procedures. We have talked about hyperbaric treatment.
What's been your experience with hyperbaric? Like a miracle? It's okay?
I love it. I had one of my patients just recently walk in or go into the hyperbaric chamber after her mommy makeover, completely bruised. And the next day after her treatment, see like a 40% reduction in all of her bruising.
And I think it's, I've seen a few, again, I think it's maybe, I wouldn't say miracles, but I've seen some pretty cool things with hyperbaric.
Yeah.
The science is awesome. So, if you think about this, if you ever put a pulse oximeter on, it's usually going to say like you're 100% oxygen. So if you give yourself more regular oxygen, like you're not going to add more oxygen to yourself. So you have to go in this chamber that puts you under pressure. And when you're under this pressure, it feels like you're flying on an airplane. What happens with the pressure is this extra oxygen, instead of being carried by that little hemoglobin that is on our pulse ox, it just goes in your bloodstream. And if you think about surgery, you're creating sort of this trauma that no longer has enough oxygen. And so with the hyperbaric, the things I'm most excited about is rapid healing, which is really important, and helps actually clear out infections, because our face doesn't really get as many infections because of all the bloodstream, and you're getting that oxygen, so it really helps improve all that. And then the other thing that people don't talk about with hyperbaric is scars. Your scars look way better. When you cut the skin, again, you've created this area that's missing oxygen. And when you put someone right away in oxygen, it's going to make a big difference on how their scars look, where they can be almost imperceptible, like without any lasers. So, big fan of hyperbaric.
I love it. I think that's the key in this next era of the undetectable era. I think hyperbaric chamber is going to be key in
Yeah,
that.
I'm so into it. Like, I just got a hyperbaric. Like, I used to send them all out, but now I just had a hyperbaric, at least in my Chicago office, not my New York office. And it's this is what it did. They delivered it. It was stuck because it was so big. Like, it was stuck in the warehouse for like a month, and they finally got it over. It broke the elevator to our building, so we have a whole
Oh
floor
my
here.
gosh.
Then it cracked all of our tile. Then we had to cut the wall. But I was like, you know what? It's worth it. So my patients can recover better. Like, and they always ask, "Oh my God, what happened to your tile?" They have to be replaced, of course. They're like, "What happened to it?" I like explained the hyperbaric. They're like, "Oh yeah, that was worth it." So
They're like, yes, we know you care about us a lot, that you would break your tile floor and go through all of this, so we have a better recovery. Who wouldn't want your surgeon to feel like that about
yeah,
your recovery?
of course. And getting patients to recover, what we're trying to do is sort of blur this line between like surgery and non-surgery. And I think people have given like filler like a bad rap. I think over the last, have you noticed that? People talk about filler like, I don't want any of this in my face. I'm injecting it in my chin, and it's ending up in like the back of my head and all that stuff.
Oh, I
Um,
mean, have you did you see the what it was a news story of an MRI that you could see years and years of filler in the patient's face. I think
yeah,
that's where it
Yeah,
got started.
I think there's one-offs. I don't think that's the norm. Like, I think if you inject fluid in your lips, it's not going to go to your temple. It's not going to go to your ear. And people talk about this shifting.
I don't think the filler stays. Look at my lips. I've been injecting them for 10 years.
So I think it's slightly overplayed. But that being said, there are some examples of everything. You know, surgery and filler. That part. I think there was an era of too much filler, and patients would go to. I think it's more in the medical spa side than in like the surgeon's office, plastic surgeon's offices.
For
Um,
sure.
they
Surgeons
would
say
go.
no.
Yeah, I think that when they go to medical spas, I think they're all run. Most of them are run by private equity groups, and their job is to make money, right? And so they'll say, "Hey, don't do what's best for your patient." It's not like we talked about earlier about having a story about this person's getting married and let's transform them and let's do what's best. It's more about we need to do more syringes. We need to sell more syringes. You should be pushing for 3 syringes here and 2 and do 5 syringes. When you do that for patients, you lose the personal aspect of what we're all about. You lose this part of that. And when you lose that, you end up with patients who just don't like, they're coming in trusting you, and they end up with this weird stuff happening. So I think that's what happened with filler.
I totally agree. I saw, I mean, I can't even think back to what years it was, but I definitely saw the increase to where the amount of syringes. I remember I worked in plastic surgery in multiple places, and most of the time patients are getting maybe 1 or 2 syringes, 3 max, like in one session. And I started to have people come in to see my nurse injector, and they were had 12 syringes in their face. And I'm like, what? Where did you go that they did 12 syringes in one sitting? And you could see it on the patient's face. They can't animate as well. Sometimes they're not even using the right type of filler in the right area. So the patients, you know exactly what I mean. The thickness of the filler is being used in areas that you could tell there was filler
And
there.
you're absolutely right. You see it in the animation a lot. That's why, like on my Insta, I'm always trying to have patients like turn or smile or do all this kind of stuff because you want to see how everything reacts to like a real face. And a fake face, if you try to animate, you like, even if you don't know anything about plastic surgery, we as humans can pick up which looks weird and fake. And a lot of people pick this up. And sometimes patients don't have this self perception, that awareness of themselves, and they think they look okay, and other people are like, "Oh my gosh, whatever she did, I don't want that. That's too much." And oftentimes they mistake bad filler for bad surgery, which is strange too.
Oh, for sure. That you're so right. Because they're like, that has to be bad surgery. You're like, no, actually, that's filler.
Um,
Badly done filler.
yeah, yeah. So
I'd
that
love
kind
to
of, go ahead.
go. I was gonna say I'd love to hear your perspective on facial threads and how have they come up in your practice?
Okay, so facial threads. You know, they some things kind of keep coming back, and they kind of come back in these different iterations. And they say like if you study history, now we always think about this for like like the like real history, but this is actually true for facial plastic surgery. So threads have kind of gone away and come back and gone away and come back. So the original threads were called feather lifts, and they were around in like 2005, 2008, 2009. And there's a whole series of New York patients who were like feather lifted all over the place. And what would happen is they were permanent threads. They would look good for about a month. And then they would have like these weird things happen, infections, and they would want to do more threads, and they would do more threads, and it never held up. And the problem with threads, they came back later and said, "Hey, guess what? We're having infections with these feather lifts. Like they're permanent. Like they have to come out." I cut out so many like feather lift threads in New York. I think like 1 week I cut out like 12 feather lifts when I was doing facelifts in 1 week alone.
Wow.
There's so many out there, and there's someone must have been like marketing like really well, but they probably aren't practicing now because they probably have so many med patients. So the threads came back, and people were saying, "Hey, these threads will dissolve in a year or 2 years," and people are like, "Oh my god, it's going to last for a year or 2 years. It's the same as a facelift." The reason it doesn't work, this is such a big point. The reason it doesn't work is because you have to like if you're doing anything, you have to like separate the tissue. It's kind of like a carpet on the floor that's tacked down. It's already stapled down. If you try to move this carpet that's on your in your bedroom, you can't move it. It's tacked down. You have to release everything. Once you release it from the tacks, then you can slide everything back, and then you'll lift and do all that. So when you just try to like put a thread here with facial animation, it's gone in like a few days, in a week, 2 weeks. And so if you're going to do it, if you really need a lift, you know what you should do?
Surgery.
Just do the lift, yeah. Just like
Just do the surgery.
exactly. Just like when patients have extra skin in their stomach, it's not an area I focus on. Like you can't get rid of extra skin. You can try all these things, but guess what you should do?
Just do
Just
the
do the
surgery.
surgery. And if you have extra skin in your neck or in your eyes and it's bothering you, just do the surgery. Don't mess around with all these other treatments because you're going to keep doing it and say, do I see a difference? I think I see a difference. That's not like what patients like. That's not exciting to see that. It's like when you're like, wow, you look amazing. Like that's a different perspective.
Absolutely. I have enjoyed having you on the show so much, Dr. Shah. How can my girls find you if they want to come see you in practice?
Okay, so I think the best way is a couple ways is probably like on my Insta, like at Shaw Aesthetics. Insta is always a great way. Insta is also a way that you can kind of look at a surgeon, and if you want to like stalk them and see what they do. If you like their work, you like it. If you don't like their work, then don't contact them. And it's a great way of looking through there. I think also a website. If you go to Noses and Necks New York, that's also so. And Shaw Facial Plastics. I have like a lot of websites as another way, but
They'll
Instagram.
be in the description.
Yeah, it's all good.
Awesome. So before I let you go, I always like to ask my surgeons if you for you to give us a tip as if you were talking to a very close friend, a sister, or a friend who's just starting their plastic surgery journey and they want to embark on getting some facial surgery. What's one piece of advice that you would give them as they start their journey?
Um, Go to someone who does this a lot. Do not go to someone who just dabbles in it, who talks about it, and make sure you have visible, credible evidence of success. Um, and the example over here is like if you go to someone who all they do is repair Rolexes, you have a very good chance that they're going to repair your Rolex. But if you go to someone who's just like, they work on digital clocks, they work on house clocks, and like you're going to bring your Rolex to them, I don't think so. So I think you go, and if they have credible evidence of success, like if you like the results and you can see it consistently, and I mean real results, not like selfies when someone's like taking a picture and they're filtered and like, or on the OR table, you want real results where you can actually credibly see them. You have a very good chance of having at least you found a good surgeon, and that means that you are more than likely to be guided in the right direction. Finding the right surgeon is so important because that office is going to help you. They're going to say what's the best thing to do, what's not the best thing to do, because they want to have the best result for you. They don't want to have you walking around because they're going to be your walking advertisement.
Absolutely. Okay, now this is my my last
You can
question.
do as many questions as you want. It's okay.
Tell me, how has online filters and Instagram filters, how has that come into your practice? How do you see that with the people that are coming in?
It's actually interesting. It's both good and bad. So here's the good. Patients, well, it's good for me, but maybe bad for patients. So maybe we'll see this. So the good is a lot of patients, it's become like a worldwide aesthetic where patients look and they actually have done a study on this, the top 100 faces of Instagram, for example, they all have the same neck. They're 100% identical. The highway position, which is something I'm really into, is like all back. It's the neck is lifted up. Their jawlines are super defined. There's like certain characteristics that are the top 100 accounts. And this isn't surgeons picking the best face. This is users. This is billions of users picking the best face. So that being said, for filters, patients look at these ideal versions. They want to make themselves look at this. Sometimes the bad on this is patients will look at someone who's not even the real version of themselves and say, I want to look like so and so isn't even so and so. Like, and sometimes I even know so and so. They're like, this is someone I saw, and like, this is someone I saw over here and here. I'm like, oh yeah, that's filtered and filtered. I can't say I know so and so, but I know so and so. And they're like, they want to look like this person, but they don't really know how that person looks because they've been filtered so much. So it circles back to like your original statement. Like you want to go there with grounded, realistic expectations of how you want to look, and if you do that, you'll be really happy in plastic surgery. You have to fix what's within. I'm circling back to what you said because if you're ready for that change, if you're not ready for the change, you won't be able to embrace any sort of positivity because you're not ready to embrace that. And the filter is the same thing. I know I'm talking about that a little bit, but the filter is really important that you have to kind of see past that and say, hey, I want to change this and change this. And I want to be able to put makeup on or do this and that and look like my best version. And I realize that this is a filter. So
I 100% agree. I think one of the things that I like to tell my girls when they call, I have discovery calls, they have questions, and sometimes they're not ready to take the jump and start looking for surgeons. They're kind of in that in between. And what I like to tell them is if you don't know what to do, focus on your skin. Get your skin as healthy as possible. Even if you're not planning to have surgery right now and you're planning maybe in 5 years, maybe in 3 years, you have that amount of time to get your skin primed and ready.
I think though, getting skin ready is like, it's such an understated like difficulty because if you actually say, so you've heard the expression, good skin comes from within. So, and so to do like to have your skin look good, and here's why it's so like challenging, because to make your skin look good, like your skin is considered like not that essential. Like your liver is really essential, your heart is essential, your lungs are essential, and then like it goes from there. So your body's going to put all its concentration there. So if you're not healthy, all of your body's energy goes towards your organs, right? And then your skin is going to be like one of those last things. Skin and hair is like the last thing. So if you have good skin and hair, you're healthy. So to get your skin like the way you want to is like you have to. By the way, your skin looks gorgeous. So
Thank
but that being said, you have to do all these things like maybe take the right supplements, maybe eat healthy, exercise, and then skincare products, and then do all these healthy habits. And if you have one bad like habit, if you smoke, your skin's probably not going to look good. If you're in the sun, your skin's not going to look good. If you're eating junk food, your skin's not going to. So all these things, it's really hard to make your skin look good. But if you're in it to win it, and you're like, I want to have the best skin, and you embrace all of that, you'll live longer, you'll look better, and you'll just have better interactions. I love changing skin.
I love it too. You brought up such a good point right now with that, like changing your eating habits, changing your exercising habits, and all of these different things that I think circling back to that mental health aspect of plastic surgery. When I feel when the women are really focused on getting themselves ready for surgery, they start making these changes, these small changes, focusing more on themselves. And it's, I like to call it, it's like their butterfly effect. They're like going through this metamorphosis of like, okay, some like changes are happening. They're going, and sometimes they end up in surgery, so they're all in dressing and facial things and garments and all. And then finally they come out on the other side as they've gone through the procedures, gone through the recoveries, gone through these transformations, got the self-confidence, have the inner, glow up, and then they come out on the other side.
I think it's like if you ever notice, like if someone's in their house and like they don't care about certain things like a couch or something, they're putting their feet up on it. They're like eating
Mhm.
Cheetos. They don't care. And that's kind of like some of my patients coming in, like they care about themselves, but they don't really care about themselves. And after surgery, it's like they've redone their whole house. They care. Like they're like, if they're like healthy, they're healthier. They're like taking care, they're doing all these supplements. They're like exercising more. And to me, that's the best part because they care more about their body, they care more about themselves. And that sounds inherently selfish, but it's not because now I see them embracing all the other people in their lives. They have that bandwidth because they're happier with themselves. They can be happier with others in their life. And that's what it's all about because, we only live once, embrace everyone. And that's the fun part. So,
Absolutely. I think we couldn't leave the episode on a better note, Dr. Shaw. It was such a pleasure chatting with you and getting to know your expertise and your thoughts. And I hope to see you again.
yeah, maybe I'm going to give you a virtual hug. And you were
Yes.
so great. Oh my gosh. So thank you so much for having me on here. And thanks for sharing your expertise and seeing so many patients and helping them along the way on their journey.
Thank you so much. All right, you guys, with that, I'll see y'all next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.